Hey guys, Dr. Mike Campion here, talking today about myth number 1 from my new ebook, 7 Myths About Low Back Pain. It's by far the most important one of all the 7 myths. If you're someone who's tried everything to help with back pain, resting, medication, injections, maybe even surgical procedures, and nothing seems to work, this video is going to give you a whole new perspective on your pain. Stay tuned because you're not going to want to miss it. Okay, so myth number 1. Now, this happens to be the most misunderstood, most widespread myth out there about back pain. And that is, back pain is usually caused by some type of damage to your body, such as a herniated disc or arthritis. This is absolutely 100% false. Now, there are instances when some type of serious pathology can cause back pain. Things such as a fracture, an infection, or cancer, but these cases are rare. Combined, they only account for about 1% of all low back pain cases. Most of the time, back pain is what we call non-specific in nature, meaning it just comes on all of a sudden, for no rhyme or reason. There wasn't anything you did to cause it, there's not anything injured in your body just decided to have some pain. This can be something hard to accept. After all, we all know our bodies. We all know when something feels different, but our body can and does react spontaneously like this from time to time. A perfect example of this is hiccups. Hiccups can be thought of as being similar to non-specific low back pain. They tend to come on all of a sudden. We all get them at one point or another in our life. We generally don't do anything to cause them. They generally go away in a short amount of time, and they don't signal that anything is wrong with our body. That's exactly how you should think about low back pain. If you experience a new onset of low back pain, the best thing you can do is not to panic. Try not to worry that something serious is going on with your body, because most of the time that's absolutely true. If you go to your physician and the physician happens to order an MRI or x-rays and those show you have a herniated disc or even some arthritis, the best thing you can do to help with the pain, again, is not to be too concerned about these findings. I know that this can be easier said than done. When you're in the moment and your physician is in front of you throwing out all this medical jargon, it can be a really scary thing. Words like degenerative joint disease, lumbar arthritis, herniated discs, they make anybody want to curl into a ball and not move for fear of causing more damage to their body. Worst of all, these words make you feel like there's nothing you can do to help with your pain because your body is physically damaged in some way. But in actuality, these findings are very normal, and it's highly unlikely that they're the cause of your pain. Let me show you why I can say this so definitively. We now know through research that things like herniated discs aren't really concerning at all because most of us walking around without any pain have these things. Take a look at this chart that will illustrate exactly what I mean. This is a summary of findings from a research article published in 2015 by Benjinki et al. This research group compiled data from 33 different studies, including over 3,000 participants. That is a monster study. These researchers wanted to see the prevalence of abnormal imaging findings in those who have no pain whatsoever. As you can see from the chart, the prevalence of abnormal MRIs and X-rays in those who have no pain is very high, and that prevalence increases with age. So from this chart, you can see if you're 50 years old, you have an 80% chance of having degeneration in your spinal disc. You have a 56% chance of having disc height loss, which just means arthritis, and you have a 60% chance of having herniated discs. Even for people who are in their 20s or 30s, the prevalence is fairly high. And remember, all 3,000 people in these studies had no pain whatsoever. You now know why making the leap that findings on MRIs and X-rays are 100% cause of your pain is a very big leap. Herniated discs and narrowing of our spine should be looked at in the same way we look at gray hairs and wrinkles. We don't get concerned when we see wrinkles or gray hairs form, but we get very worried when we hear about herniated discs and arthritis. Why is this? It's because we look at the external parts of our face and bodies quite often, probably every day. We don't get X-rays or MRIs every few days or weeks. We don't see what's going on internally around our spines. If we did, we wouldn't be too concerned about these imaging findings because it's very likely that what was found after we developed pain looked exactly the same as before we had any pain. So you're probably sitting there saying, well, if these things aren't causing my pain, what is then? Something's got to be doing it because I woke up one day and had excruciating pain that I didn't have before. Well, you're definitely right. Something is causing your pain. And that thing is your nervous system, specifically your brain. Your brain is 100% responsible for your pain. In the next video, I'm going to discuss how the nervous system can make you feel a lot of pain even when there is no physical damage to your body. I'm also going to talk about why it's actually a good thing that the nervous system is responsible for your pain and not those other structures. Lastly, I'm going to show you how physical therapy is the perfect tool for getting you out of pain. Thanks for watching this video, and if you have any questions about what you heard, please feel free to contact me at drmike@flexacare.com or visit our website at flexacare.com.